Carrie Michaels. I just spoke with some of you in our round robin event that we just had, and I'm moderating this session today. This is a presentation of the Nationwide Agricultural Experiment Station Coordinating Group called Health, Wellbeing, and Economic Opportunity for LGBT People in Rural Environments. This is also an extension of the year's work that we've been doing in the Children, Youth, and Family Consortium with Dr. Jennifer McGuire, our scholar in residence, on meeting the needs of transgender youth. So we have spent this past year traveling around the state doing presentations in communities outside of the cities and one in Minneapolis on transgender youth, talking about the research and mental health needs and nutritional needs. And from that, we got a lot of feedback that there's a lot more interest and demand in this topic area. In rural areas for all LGBT youth, and also some of those requests were coming from Extension. So I'm really glad that this group was here. We're really fortunate to have them. The purpose of this committee that you have in front of you is to first create an infrastructure for research and outreach projects across states, and they will talk more about that, and then to create and support a pipeline for people doing this work with LGBT people in rural areas. So this group has spent 2 years developing a plan for their work together, and they're now in their first year of a 5-year approved plan through the Agricultural Experiment Station. And each year they go, as I understand it, to a different location, a different state, and now they're here. And so we're lucky to have them. Thank you all. The way that we're going to do the rest of our time here is I'm going to ask each person to come up here and introduce themselves, talk a little bit about their research expertise, and then what they bring to this collaborative project. So they each have a few slides, and then we have time at the end, plenty of time for question and answer.
All right. Hi, everyone. I'm Courtney Cuthbertson. I'm from Michigan State University Extension. And thanks for having us here today. It's really a pleasure to be able to share this work with you. Generally, my research has focused on the consequences of impactful social events like government and policy changes, marginalization, and how those become individualized problems through the lens of mental health and mental illness. I'll give you a little bit of background about what that means for my past research and tell you a little bit about what I'm working on now. Generally, for purposes of this group, I describe my research as being about health and mental health of LGBT people in rural contexts. I earned my PhD in sociology from the University of Illinois in 2014. I am currently the lead community behavioral health specialist, and I have met some of you already from my other role with Extension, which is as the evaluation specialist for nutrition and physical activity programming. In my past research, I have looked at the meanings of community for LGBT people in non-metropolitan areas. With this research, I was really interested in how people find community in the first place, because in non-metropolitan areas, it's a lot harder. Some of the resources that Ramona was mentioning don't necessarily exist outside of urban centers. So in that research, I was doing participant observation and interviews in a few different areas in a community. A couple of those were churches. Some of them were community organizations that had lesbian feminist focus. And largely what I heard is for some, just having a conversation once about LGBT issues was enough because they felt they were preaching to the choir and everybody's all on board, so why do we still need to keep talking about this? And for others, it was we need to keep bringing this up because it's really important, and to make people feel welcomed, we need to continue to have these conversations. Related to that, Ramona and I worked on a project looking at community climate for LGBT folks. So really working through how to quantify a measure of if a community is supportive, tolerant, or hostile to LGBT folks. And we were looking in rural areas specifically. We did a few driving tours of downstate Illinois and tried to think about what are the different factors that would really impact the community climate here. And so the role of churches was a really big, important factor in that work. I've also looked at social meanings of mental illness, mental health care, and mental health policy. That's not related necessarily to LGBT folks, but understanding the social construction of mental health experiences and how those interact with public health frames around what mental health experiences should look like or should be. Currently, I am working on a project with the behavioral risk factor surveillance system data, analyzing nutrition, physical activity, chronic illness, and mental health among LGBT folks in urban and rural areas. So this is using 2015 and 2016 data, and I'm really in preliminary stages with that. I also, with my role in Extension, I'm working with the diversity and personnel specialist, Leonardo Pizzagna, to create for MSU Extension a workshop on sexuality, gender, and gender identity. When I have done some of introducing that with MSU Extension, I've gotten a little bit of that, but there are gay people in my community, in my rural community, they're here. So we are really hoping to put this together as maybe a 3 or 4 hour workshop to get Extension folks in Michigan talking more about this and knowing how to handle LGBT folks and issues in their local areas. So, thank you. So one of the things that we looked at were the churches in a local area and whether they made any, whether either the specific church or the denomination made any kind of specific statement about homosexuality or LGBT folks. Are they supportive? Do they have some kind of welcoming statement, or do they, on the other hand, maybe make a statement about this? God's will is one man and one woman. So we used that was one of our variables. Another one was the political voting history in the counties. And so we were using the data from 2000 at that point. So we were looking at percent of Bush voters. From an evaluator's perspective, I think another thing that you could say is please answer with the answer that is the best fit for you. And that way you can, if you feel uncomfortable talking about why the evaluation is set up that way, then you can use that instead. This is an issue that I have dealt with as an evaluator because there are specific ways that we have to report to, for example, federal funding agencies. So sometimes they restrict the way that we can ask information.